Yo, what's up, guys? Welcome back to One Motivates. Hey, so before I get started with this video, man, I just want to say, you guys, I want to tell my YouTube subscribers, thank you for coming on my videos. Thank you for watching. Thank you for leaving comments. I really appreciate that, man, because I feel like I'm not just making videos for nothing. Like, people are actually out there watching them and getting some kind of valuable information on it, And, on my channel, you're not going to get anything pressured. I never, press you because I'm in radiology. I never press you to be like, oh, go to radiology. Oh, go become a nurse. Oh, you need to be a healthcare professional. Like, no, man, at the end of the day, man, all of you guys are 90% grown and you're going to make your own decisions. And I will never push anything towards anyone. Just follow your heart, follow what you want to do, and just enjoy the journey, man. That's it. It's about enjoying the journey, enjoying people that you meet, along your, throughout your journey, basically. But so today's video, I had a comment the other day, and I don't always get to make videos like this. So when I do make them, just, I drop them like at least once every week. I try to sometimes go a little longer, and that's because I work a lot. So I don't always get to drop videos. But I had a comment about how it is to work with physicians. And, that's kind of like a tricky question because of the fact that you just never know. You don't know who you're going to work with as physicians. You don't know how physicians are going to be. Every place is different. Every physician is different. And, we have to remember, man, like, physicians are also humans. So they go through emotions. They go through, their goods and their bads. And so it's kind of hard to answer that question because of the fact, like I said, they're humans, you know what I'm saying? So they go through all the emotions that we do. But now, so to me, the nicest physicians you'll probably find will be like your local physicians. Like, I live in a small hospital. I live in a small town, which I worked in, which is a small hospital. And I have to be honest. And I don't know, because if it's just a small rural hospital and like everybody knows everybody, but I have never had a bad encounter with a physician here while working or as a patient. Everybody's like real family oriented. The surgeons are super cool. Of course, living in a small hospital, living in a small town with a small hospital, you don't get crazy surgeries. You don't get, for instance, we don't have ortho here. We don't have no neuro. We don't have, we just have basically general, like, appendectomies, what is the other thing, like, object removal, if somebody gets shot, they remove that. But like, as far as like big, surgeries, you don't get that here, so maybe that's why the surgeons are super happy, super nice all the time. But but they're super nice. I guess the smaller the area that you live in, I think the nicer the surgeons will be. Now, the hospital I work at now, it's a city, it's a bigger city, and they do everything. So you go in there for surgery, as far as an x-ray tech, you go in there for a C-arm, and you're doing, and people know what surgeons what, because not every surgeon does the same thing. You have your general surgeons, like I said, they do like anything generalized, like abdomen, just anything that doesn't involve like, how can I explain it? Like tricky situations, like neuro's for your nerves, right? So sometimes they do like kyphoplasties, which you use 2 C-arms, and they're kind of more under stress because they, as soon as they inject like the semen or whatever for the disc spaces, they want images. So you hear running 2 C-arms, do it, and it depends, man, because I've worked with surgeons that are super nice during that thing, and it's a stressful surgery. And then you have some that are super, they're just mean, you know what I'm saying? They're like, I want this, I want that, so you're like, oh, you have to be on, aware at all times, of what you're doing. And the bigger hospitals you have the urologists, and they do like cystos and stuff. So they put like, it goes through your bladder, it goes through your kidney, for like, if you have like kidney blockages or whatever, So they put like a stent in there, you know, to help your kidney like flush perfectly or whatever. Those doctors are super cool. You know, they're really nice. It's a super fast procedure. You go in there, put the C arm, take like 3 pictures, and you're done. You know, so it all depends, man. It all depends where you work. It all depends what part of the hospital you're in. You know, the crazy thing about working in a hospital is that you have to deal with 3 different personalities as far as physicians, you know, because, you know, you work in a big hospital, right? And that's small hospitals too. So you have your OR, which is your surgeons, doctors. You have to sit there and worry about and see how they're gonna act, what kind of day they're having, and you have to understand, man, when you're an OR and you're a surgeon, everything is super stressful, man, because everything lies on you, on the surgeon. You know, they have to make sure the patient is okay. They have to make sure the patient's okay during surgery. You know, when they open them up, they have to make sure that everything's on point. Everything lies on them. So I can see how they can be super stressed, you know, because it's a lot of responsibility when you become a surgeon, you know, so you have to deal with that. And then you have to go to the ER, and then you have to, deal with the ER doctor, you know, and ER doctors are a little tough because, you know, they order, so an instance, right? They order a 2-view chest, right? Okay, two-view chest, so and so, whatever. You go see this patient, and then this patient's like lying on the bed. They can't move. They can't get up. And you're like, how are you supposed to do a 2-view chest? So you go to the doctor, like, hey, doc, you know, they can't get up. They can't do this. They can't do that. Like, oh, okay, yeah, I haven't seen a patient yet. Like, so who's putting orders in? You know, so and then sometimes, you know, it's like the nurses put orders in, and I don't even know how they got that right. But anyway, sometimes you know, the surgeons don't even see the patient yet, and the order's already there. But you know, 90% of the time, you know, they'll change it to be like, okay, it's a 1-view, and then sometimes like they're like, no, I need a 2, and there you go, struggling trying to get a 2-view chest on a patient that don't even move, you know, and so that's another dilemma you deal with. And then you have to deal with the inpatient doctors that want everything stat. You know, they're like, okay, well, for instance, on a weekend, there's only 2 techs, right? You have an ER tech, and then you have a tech that does OR and inpatient portables, they call them, right? So then you're stuck in an ER, you're stuck in an OR case, you're almost done, and then the inpatient doctor on the 3rd floor calls and be like, hey, I need a stat X-ray chest. I'm like, okay, sir or ma'am, whatever, dog. I can't get there yet. I'm in the middle of a surgery. I'll be there as soon as possible. They're like, no, I need it now. And it turned into a dilemma, you know what I'm saying? So it's kind of like, so it's hard to explain how it is and what kind of surgeons you're going to deal with, you know, I mean, or just doctors in general. Because every place is different. Every doctor is different. Not all of them are mean. And just because one tech or one nurse or whatever field you decide to go on to, and be like, hey man, don't mess with this doctor because he's like super mean and super this. You can't always go by that until you actually work with him, you know, because, you know, knock on wood, right? I had this doctor that like, hey man, he's blah blah, he's super mean, he yells, blah, and then like, and of course they stick me with him, right? I'm like, man, I'm like, all right, you know, I was already kind of like mentally prepared for it. Like, okay, I'm gonna get yelled at, you know, whatever the case may be, right? So you go in there, and this dude was super nice, man. When I tell you he was nice, I'm like, this cannot be the same dude that they said that was super mean. But like I said, of course, I caught him in a good day, you know, and not every surgeon gonna catch in a good day. So I was blessed enough, man, to catch him on a good day. And the cool thing about it, that he usually don't work weekends, and it was a weekend case, and he was super cool, man. So I was thankful that he was awesome. But I've heard stories that he can be like super crazy, super mean, yelling, blah blah, and you know what's cool about surgeons too in a OR is that same surgeon that I said that was mean, but he was super nice to me. Dude, they be like blasting music in there, man. Like when I say blasting music, like, you know, the surgeons that you wouldn't even think, they be blasting like Kodak Black. They'll be having like a Juvenile. I'm like, how do you know about this music? Like, it's crazy. And I'm not just talking about, oh, the volume's a little up. Like, no, they be like blasting like you're in like a little like an actual club. And it's crazy how they that's how they mentally stay focused, you know what I'm saying? Because that's the distraction, you know what I'm saying? Like, you know, I feel like when they went to school, like they listened to like Kodak, they listened to like, you know, Jay-Z, they listened to like Kanye West, and that kind of kept them focused. So when they go in the surgery room, they need that mental focus. So they put the music on, they blast it, and then, you know, so it's nice because it's a good atmosphere. But then at the same time, you have to be, like I say, you have to be aware and you have to be on point, because, you know, everybody's wearing masks, everybody's geared up. So if you want something and you can't hear them clearly, then that's when they get upset, you know. So you have to be like, so you can't even enjoy the music sometimes because you have to sit there and be like, what did he say? You know, what does he want? He wants lateral. He wants what does he want? Angle, you know. So, but at the end of the day, man, it's all about how you go, how your perception is, right? If you go and you become a nurse, anything in the medical field, whatever you decide to do, just know that, you know, what you're dealing with sick patients, you're dealing with doctors that are under stress all the time because of the fact of what they have and all the responsibility that they dealt with, you know, when you become a physician. So just know that if you go to the medical field mentally prepared, knowing that, you know, anything can happen at any time, if you're mentally prepared for that, you'll be fine, no matter who's a surgeon, no matter what happens. So, you know, I hope that this helped a little bit. Leave me comments, y'all let me know what's up. And as always, thank you for watching, thank you for supporting. To the next one.